Adam Orlando here from Concordia University, Wisconsin's Occupational Therapy Department, and in this video we'll be talking about differential diagnosis. So let's give a brief definition of it. It is the method in which healthcare providers use information to make decisions between two or more alternatives to help explain why their patient has a particular set of signs and symptoms. This can be established by looking at the patient's history, clinical examinations, diagnostic tools, as well as establishing an occupational profile. So this is basically a thought process that healthcare providers use to help narrow down the diagnoses. So we basically listed out this thought process. So in step one of this thought process, we want to brainstorm all possible diagnoses that could be associated with the symptoms. Once we've done that, we want to establish the occupational profile. And this is done by asking the client a series of questions. These questions can include: what are the symptoms? When do they start? The severity of the symptoms, the cycle of the symptoms, activities that can provoke these symptoms, as well as activities that are now challenging because of these symptoms. Now there are other questions you can ask, but these are the ones we just included. Once you've done that, you can probably narrow it down to 2 or 4 possible diagnoses. Once we've gotten to this point, we can then look at our scale. Now, the scale is going to be different for all diagnoses, populations, and each individual client. It's just important to note that this is just a thought process based off of your own clinical judgment. And in this case, we have 0% sure on this side of the scale, saying we have no idea what this diagnosis is. And on this side of the scale, we have 100% sure. But like I want to note, this could be different for every client. Closer to our 0% sure, we have a test threshold. And on closer to 100% sure, we have a treatment threshold. And in the middle, we have further testing required. So depending on where we fall after narrowing it down to 2 or 4 diagnoses, we might have to do further testing, or we can start our treatment based off of the percentage of how confident we are after establishing that occupational profile. It is important to note that this scale, again, can be different for every client, patient, or diagnoses. If you have any further questions, please refer to our handouts attached underneath the video. Thank you.